will be recorded. So today I just want to introduce Stephanie Adams. We've been spending some time planning out this event for a few weeks now, and she's been instrumental in sort of rounding out the right people and getting the conversation going. So Dr. Adams has more than 20 years of experience in the biotech and pharmaceutical industry, and most recently she served as a consultant with King and Spalding's intellectual property counseling practice. And as a senior patent agent, she worked with inventors, universities, and biomedical companies to evaluate potential inventions for patentability and commercial values while developing and implementing appropriate strategies. Stephanie's expertise extends across a wide range of biotechnical areas, including molecular biology, neuroscience, immunology, and vaccines. Stephanie also served as an executive director of Southeast Life Sciences, formerly Southeast Bio. And as director of this regional nonprofit organization, she augmented the growth of the life sciences industry in the southeastern U.S. through efforts that promoted entrepreneurship and brought together companies, investors, universities, and support organizations. She's been active in the Georgia and southeastern life sciences community for over 20 years now, and promoting its growth through involvement in industry organizations, events, speaking and client counseling. And this promotion is extended into the community through a variety of sciences-based initiatives at local schools. And Stephanie obtained her PhDs from Emory University, and her research focused on the molecular biology of novel peptides involved in the central control of reward and safety, and was presented at numerous international symposiums and published in prominent scientific journals. Again, this has been a long time coming, so I'm super excited to have her as the host driving this conversation. So Stephanie, if you want to jump on and take over. And ladies and gentlemen, Stephanie Adams, please give her a round of applause virtually.
Thank you. Thank you so much, Alfred. It's been great working with you and the team to pull this together. We can start our slides, I think, at this time. If we can share. Okay, great. So yes, we are very excited to kick off this vaccine awareness session in conjunction with Microsoft. Microsoft has been a strong partner of ours since we started. We started at the outset of the pandemic in March of 2020. We are very excited to have with us today a distinguished panel of speakers. I will introduce them by name quickly and then introduce them more fully before their segment. And I would just ask the speakers, as I introduce you, if you could just turn your camera on. So first we have with us Joynetta Bell-Kelly, who is a public health advisor at the Center for Disease Control and Prevention. So thank you so much, Joynetta, for joining us today. Next we have Dr. Veronica Womack, who is joining us from Georgia College and State University. We also have Dr. Xanthia Wiley, who is joining us from Emory University, and she's an infectious disease doctor. And finally, we have Mr. Leo Weekland, who is a director with our nonprofit, and we'll learn a lot more about that in a minute. So thank you all for being here, and we look forward to a great discussion. We'll be monitoring the chat, and we will have each speaker, if there's time at the end, we'll have questions for each speaker for a couple minutes, and then we'll have a question and answer session at the end as well. Next slide, please. Just an overview on who we are. We were launched, like I said, in March of 2020 in the face of the pandemic. We were fortunate to receive seed money from Microsoft and the CDC Foundation, and Microsoft has been a very close partner and involved in many of our initiatives. Through the COVID pandemic, and what brings us here today is that the pandemic really revealed gross health inequities in our country. And through our work in the pandemic and all aspects of the pandemic in 2020, we have really refined our mission so that our central mission is to focus on health equities domestically. Eventually, we hope to go global with our organization, but we're a new organization and we were launched in the middle of the worst pandemic that we have seen in over 100 years, and have certainly had plenty of involvement and opportunities to make a difference within our domestic communities. And so we, again, through learnings of the COVID pandemic, and as we will learn more today through our speakers, the health and social inequities have really been magnified, and we are committed to redressing this balance through a lot of our programs. And our programs have largely become community-based to intervene in the communities that are most affected by this pandemic. Next slide. We really work to solve problems through a unique combination of learning from problem experts such as government organizations and NGOs, and then trying to match that with problem solvers, well, whether it be through our corporate partnerships like with Microsoft, or if we individually decide to pursue different efforts and receive our own grant funding. Next slide. These are some active health equity projects that we have been working on. Safe Schools has been a fundamental pillar of our organization since the beginning. PAVE was a tool for vaccine equity that we launched in conjunction with Microsoft. We have an active program in mental health. We also have a very active program on trying to create information equity through culturally appropriate messaging through our COVID project, which we'll talk more about in a minute, and our Worship Action Coalition, which is our engagement of faith leaders to help build confidence in COVID vaccination in underserved communities. And I will briefly touch on both of these programs so that you can understand how we are engaging these local communities, and then we'll move to our next speaker. So next slide, please. So as we stated, our Worship Action Coalition has been an effort that's been underway for about a year. We have over 150 participants in this coalition, and we have faith leaders representing over 35 different houses of worship across 8 states, interfaith nonprofits, large faith-based national organizations, the CDC, HHS. We really have seen this as a pillar for community involvement and engagement, and using faith leaders as trusted messengers in building vaccine confidence in their communities. Next slide. And finally, our key project for this year in conjunction with the CDC is our COVID project, which stands for COVID Vaccine Information Equity and Demand Creation. So it was clear to us about a year ago that a one-size-fits-all messaging approach will not effectively ensure that all populations receive that message and receive it positively and agree to be vaccinated and build vaccine confidence. So we are looking at ways that we can create population-specific messaging and broadly disseminate that to help address COVID vaccine hesitancy in populations of need. And this has been a wonderful effort with a large number of partners, as you can see here. And this is very representative of how our organization is meant to work, by bringing together government, private companies, universities, and looking to solve a problem. So that is a project that you'll hear a little bit more about later. So next slide, please. So without further ado, I'd love to introduce our first speaker, Joynetta Bell-Kelly, who is a public health analyst with the CDC. She has been a public health professional with over 17 years of public policy, communication, community capacity building, and partner engagement experience. She has a passion for empowering individuals with tools, health resources, and services which will improve health and health outcomes by eliminating social determinants of health. We are so excited to welcome you, Joynetta. That's exactly what we hope to accomplish here today. Number one, we hope to share some stats and information with you from Joynetta and Dr. Wiley about COVID-19 in the Black community, just to get everyone on the same page. And then number two, we really want to empower you as leaders within your communities to go out and help build vaccine confidence throughout this country. So thank you all so much for joining, and Joynetta, thank you for being here.
Thank you so much. And oh, I hear a lot of feedback. I'm not sure if it's my headset or not. Can you all hear me? Okay, good. Well, thanks for having me. It's such an honor to be here today to speak with you all. And I'm having a little bit of technical difficulties with my camera, so I might have to go off. It looks like my screen is freezing up a little bit. So just to warn you, in case you don't see me, I'm just going away for a little bit. So anyway, I am a public health analyst with CDC and a lead for the community engagement and health equity consultation team within the adult immunization program. So I'm really happy to be here. Next slide, please. So whenever we do these talks, I always like to level set. We know this all already. We've been seeing it on the news. We've heard it. We're talking about it around the dinner table. But I just like to make sure we kind of have a general education on what COVID-19 really is. So as we all know, it's a virus that was discovered in December of 2019, hence COVID-19 for 2019. It's it has quickly spread around the world, which has caused it to be a pandemic. It's most often causes respiratory symptoms that can feel much like a cold, a flu, or pneumonia. But we now know that COVID-19 can also harm other parts of the body. So most people who catch COVID-19, have had mild symptoms with the previous variants, but some people can become severely ill, and things have changed as we've seen with the Delta variant. And just another small thing that I just wanted to make sure we all understand is that coronaviruses are a large family of viruses that can infect people and some animals. It's a family of viruses, and it just so happens that this one is the new coronavirus, which some of you have probably heard the term the novel coronavirus. So that just means the new coronavirus under the whole umbrella. So we all know that some people are more likely than others to become severely ill. And severe illnesses mean that a person with COVID-19 might need hospitalization, intensive care, ventilator support, or could possibly die. And people at increased risk and those who live or visit with them need to take extra precautions to protect themselves from getting COVID-19. So we know that there is a long-standing systemic health and social inequities that have put various groups of people at increased risk of getting sick and dying from COVID-19, including many of the racial and ethnic minority groups and people with disabilities. So studies have shown that people from racial and ethnic minority groups are also dying from COVID-19 at younger ages, especially now with the Delta variant. People in minority groups are often younger when they develop chronic medical conditions like asthma. As a matter of fact, my 3-year-old just was diagnosed with asthma. And it's really interesting how things like that kind of grow with the child and kind of fade away, hopefully. And children and younger people may be more likely to have more than one condition. So also people with disabilities are more likely than those without disabilities to have chronic health conditions, to live in congregate settings and face more barriers to healthcare. Studies have shown that some people with certain disabilities are more likely to get COVID-19 and have worse outcomes as well. Next slide. So again, just want to level set on the Delta variant and how variants work. So if you envision a tree with branches, each branch on the tree is slightly different than the other. So by comparing the branches, scientists can label them according to the differences. And the small differences or variants in this case have been studied and identified since the beginning of the pandemic. So some variations allow the virus to spread more easily or make it resistant to treatments or vaccines. And those variants must be monitored more carefully. Specifically with the Delta variant, it causes more infections and it spreads faster than earlier forms of the virus that causes COVID-19. It might also cause more severe illness than previous strains in unvaccinated people. So vaccines continue to reduce a person's risk of contracting the virus that causes COVID-19, including the Delta variant. There have been many questions about, does this virus or does this vaccine actually work for the for the Delta variant? And studies have shown that it does. It is effective. Vaccines continue to be highly effective at preventing hospitalization and death, including against the Delta variant, and fully vaccinated people with breakthrough infections from this variant appear to be infectious for a shorter period. So the important point of this is to ensure that you get vaccinated and wear masks indoors in public spaces to reduce the spread of the variant. Next slide. So I just wanted to point out some of the high risk groups. Adults of any age and with any of the following conditions, and these are just in alphabetical order, is the following conditions can be more likely to get severely ill from COVID-19. And when I say severely ill, as I mentioned before, that could mean hospitalization, intensive care, a ventilator, or it could result in death. In addition, some older adults are more likely to get severely ill from COVID-19. And prior to the Delta variant, more than 80% of COVID-19 deaths occurred in people over age 65, and more than 95% of COVID-19 deaths occur in people older than 45. But we all know that longstanding systemic health and social inequities, again, have put various groups of people at increased risk of getting sick and dying from COVID-19, including many racial and ethnic minority groups and people with disabilities. Next slide. So here, I'd like to show this graphic about the flu, just to put COVID in perspective with flu vaccinations. As we see here, the vaccination rate for African Americans, the lower flu vaccination uptake among Blacks is 41.2 and Hispanics 38.3. And these are longstanding issues that have been going on for a long time with the flu. So if you compare this to the next slide, which will show you even more of the urgency of getting the COVID-19 vaccination, a lot, excuse me, a lot of information has come back with those in the population who want to just wait and see how the COVID-19 vaccines are actually working for others, and percents of people who say they are very concerned about the vaccine. So if you look in the first grid, the not knowing the long-term effects of COVID-19 vaccinations, you see that the dark blue line represents the African American community, and 57% represent that first area where those who are hesitant about getting the vaccine are hesitant because they don't know the long-term effects of COVID-19, and they're worried about that. The second is the experiencing serious side effects. Folks are still wondering, what are the side effects that I'm going to get from this? So let me just wait and see. Actually, a dear friend of mine, I was talking to her about it the other day, and she said she wanted to just see how this thing plays out, how it shakes out before she gets the vaccine. And it's very important to make sure that our communities and that we are educated about the vaccine. We're educated about the illness, so that we make the best choices for our families and for ourselves. But these are legitimate concerns that people have, and it's best to, again, make sure that we're educating ourselves with the correct data, with science-based information, with peer-reviewed information. Next slide. So just a little bit about underlying conditions. As of last night, actually, and by the way, the CDC COVID tracker is updated on a daily and a weekly basis. So as of last night, 31.7% of African Americans have received a vaccination, and it's still landing the last place slot among all racial and ethnic groups. And here are some facts about underlying conditions that are prevalent in the African American community and could further cause illness, and in some cases, death. So in 2018, non-Hispanic Blacks were twice as likely as non-Hispanic whites to die from diabetes. And also African American adults are 60% more likely than non-Hispanic white adults to be diagnosed with diabetes by a physician. In 2017, non-Hispanic Blacks were 3.2 times more likely to be diagnosed with end-stage renal disease as compared to non-Hispanic whites. And also in 2017, non-Hispanic Blacks were 2.3 times more likely to be hospitalized for lower limb amputations as compared to non-Hispanic whites. So these are just some of the conditions, some of the underlying conditions that stand out as chronic illnesses that can definitely have a different type of outcome if someone does contract COVID-19. Next slide.
Absolutely. And Janetta, the chat is filling up. So, and I think
Oh,
we have a
sorry.
few more minutes. So I was going to see if you could field some of these questions.
Oh, sure.
And then we may need to move on. But we have a question. Is there an easy way to help me understand what causes the variants? And are the variants here to stay?
Well, with the variants, the problem is that it is it probably will there probably will be more variants in the future if there's not a higher percentage of people getting vaccinated. So as you think of the tree growing with limbs, as this disease, as this virus continues to develop and manifest, it's going to keep changing and changing and changing. So that's why it's so important to make sure we're getting vaccinated so that we can reach a point of immunity where the virus can actually, slow down and not continue to grow. I hope that answers the question.
Yeah, exactly. As long as people are unvaccinated and it can kind of fester in populations, it will continue to variant. It's a natural progress with viruses, and so they're here to stay as long as we have the virus around. And then the previous slide did say that only 41.2% of African Americans traditionally get the flu shot, right? And I've seen that before, and it's been a common disparity in acceptance of vaccines. So yeah, I think that is the right stat. What defines a serious side effect? I assume they're talking about COVID-19, and maybe Dr. Wiley would be good to answer that in the next one. And then, is there a vaccine that we will need to take every year, like our flu vaccine? That's a good one for you, Janetta.
Is COVID a vaccine that you'll have to take every year? Is that was the question?
Yeah, like a flu vaccine.
That is still being studied. As most of you know, the booster shot is it's been recommended to that certain groups take the booster shot. Honestly, it's still growing. The science is still coming in. We're still learning how these vaccines are affecting folks and how long they actually last. So an honest answer is we don't know yet. But this is being studied, and as soon as information is available, it's being released to the public. So I'm sorry, I don't know. We don't know yet.
Yeah, we don't know yet. And then one quick question just to clarify. It says and then we may end up with answering more of these later on, or we can answer them by email as well. It seems that a lot of hesitancy is due to the fact that the vaccination does not prevent COVID-19, and in particular, the Delta variant. Further, we've seen people who have been vaccinated die after contracting COVID-19. How do you instill confidence in those who don't see a way forward with or without the vaccination?
Well, the vaccination actually does help prevent a person from getting very sick and from dying. So I think a lot of misconception has come with, okay, I got the shot, so I shouldn't ever get COVID-19, and that's just not true. It's just like with any other vaccination. If you get the flu shot, you can get the flu. I had the flu shot and I got the flu. My brother had the COVID-19 vaccination and he got COVID a couple months later. Now the difference is when he had COVID before, he couldn't breathe. He had a really, really rough time. He was just down. He couldn't walk around to do things for himself. But the second time around, after he had the vaccination and he had COVID again, he only lost his sense of smell. He didn't even know he had COVID until one day he was cooking and couldn't smell anything. So that could be a big difference. So the shot doesn't prevent you from getting COVID necessarily. It will prevent you from having serious side effects, having to be hospitalized and death in some cases. Again,
I think that's true for the flu too, that people think that's a misconception as well. You can still get the flu after you've been vaccinated for the flu, but it prevents a severe outcome. So,
Absolutely.
well, thank you. And thank you for all these chats continuing to roll in. In the interest of time, thank you, Janetta. We're going to move on to Dr. Wiley. And Dr. Wiley is a physician in the Department of Medicine and an associate professor in the Division of Infectious Disease at Emory University. She has her MD and her Bachelor's of Science from the University of Alabama. And I'd like to share a recent quote by Dr. Wiley to frame her discussion. COVID-19 has truly magnified what I already knew was out there. To see how this has ravaged our community and our world has been life-changing. What can I, as a Black woman physician from rural Alabama, do to help my people? I think this quote really encompasses extraordinarily well her efforts on COVID-19, as well as our own call to act as leaders in community engagement to drive vaccine confidence. So we welcome Dr. Wiley, and thank you for sharing your time today.
Thank you for having me. So I don't see the slides. I guess they're coming back up. There we go. There we go. So everyone, thank you so much for having me. And I think it's so important to have questions, honestly, more than anything. So I'm going to go through my slides maybe a little quicker than I would have, so we have enough time for questions. So at the end of my piece, I really hope that all of you will be vaccine ambassadors, because I consider myself a vaccine ambassador. So just like Dr. Bell said, what we know for sure is COVID has disproportionately affected Black, Indigenous, Latinx communities and other people of color the most. Next slide, please. And so what we see here is looking at lab confirmed COVID-19 associated hospitalizations, and we're looking at this cumulatively by race. So at the top, what we see are, really high rates in the American Indian, Alaska Native population. Next is our African American Black population, and next our Hispanic and Latino population. So that you see over time, the highest numbers, those who are hospitalized, have looked like a lot of us on this call. Okay, next, please. And, the key to this is life years lost. So this is looking at life expectancy, comparing 2019 to 2020 based on your race. And what we're showing here is that if you are a Black man, life expectancy for Black men from 2019 compared to 2020, we have lost 3 years. For Hispanic men and Black females, we've lost 2.4 years. So, when people, and it's a great question, like, why should I get vaccinated? You can still catch COVID. The key is, this highly significantly decreases the likelihood of you having severe illness and of dying. And the life expectancy, particularly in Black men, we have lost 3 years of life from life expectancy. Next, please. So in my opinion, what is the best, honestly, only way for us to eradicate COVID, this is with vaccines. We cannot mask our way out of this. Next, please. Okay, and Dr. Bell kind of showed a similar slide to this. So when we're looking at least one dose versus the fully vaccinated, again, this is over time. This is from January until now. The orange dotted line are Black non-Hispanics, and you can see that based on race and ethnicity with respects to who has received, whether it's one dose or their 2 doses or being fully vaccinated, even with Johnson & Johnson, Black persons are the lowest. Next, please. Also, so this also came from the CDC looking at intent to get vaccinated, and this was a snapshot from a couple weeks ago. So this data was collected from September 12th to September 18th of 19,000 people. So what I want to bring your attention to is this peach color, which is those who will probably or definitely say they're not getting vaccinated. Now look over here at race and ethnicity. So I'm sure we've all heard that Black people are hesitant, Black people don't want the vaccine, et cetera, et cetera. That has changed over time with education, and we see some improvement in this. Because even if you look over at race and ethnicity and look at Black, look at the chunk of orange there. compared to even Alaska, American Indian and Alaska Natives. Look at it compared to white as well. So we have made some improvement with respects to vaccine hesitancy in the Black community. Now, when you look at age and look at 18 to 28 years old. We have a lot of room to go with young people. Okay, so young people are the most likely to not want to get vaccinated. I won't go into the rest of these, but the lower the level of your education, you're less likely to want to get vaccinated, and your lower income. So there has been improvement, thank goodness. Okay, next slide, please. Now, I can't talk through this without talking about access. So, everyone loves to say, you're vaccine hesitant, Black and Hispanic people aren't getting the vaccine because they're hesitant. Access is huge. Access is important. So just kind of take a look at this. So in the United States, our kind of opening up vaccine programs to community health centers, this happened April 7th. Okay, this is my personal opinion that was a bit late, because when you think about it, 70% of community health centers are, targeting, people of color. So if you are a person who is living in a rural area without transportation and you don't have great internet access, how are you going to get your vaccine? So some of this is hesitancy, but we're not going to blame it just on hesitancy. This is access as well. So this is nationwide. Next slide, please. But let me just give you, I'm not sure how many of us are here in Atlanta, or we're all in Atlanta, but I have to share this because this was huge for me. So this is in February, looking at where are COVID vaccine sites, and this was Publix and Kroger vaccination sites in Atlanta. So you'll see the arrow pointing at Interstate 20. Okay, and for those of you who don't know Atlanta, south of Interstate 20 are a lot of predominantly Black areas. Those little dots are vaccination sites at these grocery stores. So it doesn't take anyone super brilliant to see that there are a lot of these dots in areas that are more predominantly white compared to the dots south of I-20. Where a lot of Black people live. So yes, there's hesitancy, but we have to ensure that people are able to get to the vaccine. Next, please. And I'm almost done. Okay, also with respects to trusted online sites, I think we've all heard someone say, my cousin said, my aunt said, Instagram said, Facebook said. Next slide. So what I always like to tell people, if you're going to look for a place online to get your information, cdc.gov, ACP, American College of Physicians, Infectious Diseases Society of America. But I always mention this one right in the middle, the National Medical Association, which is the National Association of African American Physicians, like thousands of Black doctors, all specialties. And, it is on the site that says vaccines that we support people receiving the vaccine. Okay, so in case, and because there's a lot of misinformation, and it has broken my heart to hear that there are even some Black physicians who are telling their patients to wait and not get the vaccine. Those people do not represent the vast majority of us. Next, please. My motivation. Next slide. And I think my motivation is what everyone else's motivation is. This is my family. So I am from a rural, tiny town in South Alabama called Evergreen. I grew up in a single parent household. You see there's tons of women here. And just kind of want to show you how this, how COVID has really affected my family. My little cousin right here in the green contracted COVID by working as a greeter at Walmart. My mother, with she's the blue arrow, has gone through surgery 4 times this year, and that was why I wanted her to get vaccinated, because she was in and out of surgeries. My aunt, the orange, she contracted COVID as a registered nurse. My aunt with the red arrow, she is a transplant recipient. And, all of us also got vaccinated for my, baby cousin, because she couldn't get vaccinated yet. So this is affecting, to kind of think about getting the vaccine, not just for you, but for your family as well. Next slide. So with respects to everyone becoming kind of COVID vaccine ambassadors, I've had the opportunity to kind of talk about COVID vaccines on a national level. So my aunt and I, had an interview with the New York Times back in January. As I walk around in my hospital, I literally and figuratively have held people's hands as they get their vaccines. And I've done many of these forums, but I'll be honest with you, I think the best vaccine ambassadors are not necessarily physicians. It is you all who have received your vaccines and can tell your loved ones, I got it, I did fine, can you please get it as well. So thank you all for your time and look forward to your questions.
Yeah, thank you so much. And I've been trying to triage a little bit. There's been a few questions on sort of treatment options once you get COVID. Unfortunate, and we're very sorry to hear that someone's family members had died even after the COVID vaccine, going along with like, what are current treatment options? What is the chance of death after vaccination, which I know is really low, and we're very sorry to hear that. Preventive measures that can help you not get COVID. This is all sort of in the treatment, preventive, and then serious side effects of COVID, kind of going along that line of questioning, if that's helpful.
Absolutely. So the best preventive method, and I know everyone's heard this over and over again, it's the vaccine. Yeah, so you can socially distance, you can wear masks, et cetera, which is fantastic. But these vaccines, I want to tell you all, the messenger RNA vaccines, their effectiveness are like in the 90s. Flu vaccines, sometimes our best flu season, we have effectiveness in the 70s. So I don't want people to feel like, if it's not 100%, these are not very effective vaccines, because they are. With respects to treatment, we do not have great outpatient treatment options. Please don't believe that ivermectin is a treatment option at this point. Ivermectin, we're doing studies to see if that will work. If it becomes severe enough and you have to come into the hospital, treatment includes steroids and remdesivir, which decreases the amount of virus, and supportive care. But the key is we really don't want people to kind of think about what are going to be the treatments once you get it. The ultimate goal is prevention. And you getting the vaccine, this isn't just about you. This is about your loved ones. That's, immunocompromised person in your family, your little cousins, your children who can't get vaccinated yet. By you getting vaccinated, you're going to decrease the likelihood that they contract it.
Thank you. And just a comment about the Moderna vaccine. Someone was asking about the efficacy at 9 months, and there's a little bit of confusion around that right now because Pfizer has been approved for boosters, but Moderna has not yet been that. And I think the data is a little bit more positive or longer lasting on Moderna. So if you could comment on that.
Absolutely. So what we know, at least with Pfizer, actually, each of these vaccines, with time, when you get to that kind of 6-month mark, your immunity level will wane. However, this does not mean that it is completely gone. So I got both of my vaccines. My second one was in January. I'm due for a booster as a healthcare worker. Do I have antibodies right now? Of course I do. But you want to, increase that likelihood. With respects to the effectiveness, the highest effectiveness is with the Moderna and the Pfizer vaccines. I'll be honest with you, compared to Johnson & Johnson. For people who have, panic and fear from getting a shot, the benefit of the Johnson & Johnson is it's, one shot. But if you're not afraid to get shots, in my opinion, I would go with the most efficacious ones, which are Pfizer and Moderna.
Okay, thank you. Thank you so much. And we'll continue to look at the chat. I know there's a string of chat questions about HIPAA, and I would invite all of our speakers to kind of look at that, and maybe we can save that till the end. Okay. And so next, I would love to welcome Dr. Veronica Womack. Dr. Womack also holds her doctorate from University of Alabama. We've got a bunch of Roll Tide here today. For those of you in the South and familiar with Southern football. She has spent nearly 20 years in higher education as a political scientist, rural researcher, and Black Belt region supporter. She currently serves as executive director of Georgia College and State University's Rural Studies Institute in Milledgeville, Georgia. Prior to that, she served as the institution's chief diversity officer and professor of political science and public administration. Focusing her work on the underdeveloped rural South, Dr. Womack has brought local and global attention to underserved communities. And since the pandemic has begun, she has been instrumental in using her rich network to aid in the COVID response. So we welcome Dr. Womack.
Thank you. Thank you so much. And Zenithia, I am from Greenville, Alabama.
You are not from Greenville.
Yes, I am from Greenville, about 30 minutes apart.
Oh my gosh.
Yes, I'm super excited to be here. Thank you so much. I'm a little bit, my presentation will be different than the other two in that I'm a social scientist. And so I'm super excited to have worked with the COVID group to look at messaging. And so particularly for the presentation today, we'll be moving into the rural South. So next slide, please. So our collaboration included farm co-ops, the 100 Black Men of Augusta, Augusta University, Kentucky State University, and Tuskegee University. Next slide. Okay. Part of the research that was provided for your presentation comes from the recognition of the unique cultural history and experience of African American people within the rural South. Keeping in mind that African Americans typically have a very low trust level for institutions of government and other institutions. For example, the Pew poll showed in April of this year, just 37% of Black people trusted government. So the history of medical experiments within the South has been an issue, and the fact that we have very low broadband access and information is not always fluid in the rural South. Next slide. Okay, next slide, yes. So why is the South so unique? First, 55% of Black people live in the southern region of this country, and the map on the left looks at the slave population in 1860, and then on the right, this is data from the 2010 census. And so you see some very distinct regions, the Mississippi Delta, the Alabama Black Belt, all the way from eastern Texas to the eastern shore of Virginia. So very prominent African American populations within this region. Next slide. Particular for this research, we focused on the Mississippi Delta. Folks from Kentucky, many of them migrated to Western Kentucky, which is one of the sites that we held sessions. And then, of course, the Tuskegee syphilis study. Next slide. It's important to note as we get into this discussion about African Americans and their discussions around vaccines and hesitancy is the migration that a lot of the stories and the narratives that surround medicine and government has went with us as we moved out of the Deep South. Next slide. So this particular research focused on several rural communities and African American communities within those regions. So we looked at Logan County, Kentucky, that had about a 6% African American population, Augusta, Georgia, Tuskegee, Albany, Georgia, and Epps, Alabama. Next slide. So if you think about those communities, they are rich in history and they have significant African American populations. The US population, 13.4%. Some of the communities in which we had discussions were over 95% Black. Next slide. So the discussions that we had centered around the vaccine, hesitance, where people were getting their information on COVID, reasons for not taking the vaccine, what could persuade them, and who might change their mind. So just some very general 90-minute discussions about COVID. Next slide. And of course, some of the themes that were revealed was something that probably would not surprise you: fear and distrust of the vaccine, distrust in government, the medical establishment, need for more information about the vaccine, about variants, about boosters. But we also heard some really great information about cultural differences, the agrarian traditions of the Black Belt Rural South, people using medicinal herbs to combat the virus, self-medication. People are really feeling like money was driving this COVID discussion. And what really stuck out for us was this lack of information and knowledge about social media and algorithms and how this was perpetuating misinformation and disinformation around COVID and the vaccine, as well as religion. Next slide. So some of our takeaways was this deep entrenched distrust of medical and government establishment. The fact that the significance of the history and culture of the rural South impacted people's perceptions about the vaccine, but also access to, to really good information about, effective information about COVID. But more importantly for our discussion today is just the power of the misinformation that's occurring in rural communities. Many of these folks live many, many miles away from each other. And so social media is a big part of their social network. And so the sharing of misinformation and disinformation in small communities in these media clusters is just amplified. Next slide. So there's really an urgent need for us to not only educate ourselves, but about the workings of how social media works, but also take it upon ourselves not only to be vaccine ambassadors, but also misinformation ambassadors, making sure that people understand when they get information from social media, from Facebook, from TikTok, from Twitter, that information is not always vetted. Next slide. So recently, NBC News had a wonderful article about this misinformation and disinformation specifically focused on African Americans and the danger of this repackaged misinformation specific to the African American community, and it's tailored to touch on our unique cultural heritage and the experiences that we've had in this country. So it can be very powerful and persuasive. Yes. Back one. So just as of September 28th, we see that our great state of Georgia, we have, we don't have half of our people vaccinated at this time. And when you go in rural communities where they, this COVID pandemic has just devastated many of these communities, we have an added responsibility to speak about misinformation and disinformation on COVID. Next slide. So a way forward to recognize that we do have this distinct cultural history as it relates to medicine and government. And so we can't tell people that they're thinking irrationally, right? Some of the things that they've gone through, the Tuskegee group, for example, we met in Tuskegee, Alabama. So that history is still there and is still relevant. But what we can do is to seek understanding about ourselves, about social media, be very cognizant about the information that we're receiving and the information that we're sharing, and to inform other people about how social media actually works. And we have to do our own internal work about the impact of COVID in our lives, in our community, in our extended community, and make a commitment that we will not perpetuate misinformation and disinformation online. Next slide. All right, thank you.
Thank you so much. We really appreciate it. And yeah, I think you're setting the stage exactly for how we're hoping to create vaccine ambassadors within communities, and also make sure we have forums like this so that questions and answers can be given, misinformation can be cleared up, and then that can be propagated. I am cognizant that this has gone really quickly this hour, and I think a lot of people have commented that on the chat as well. I'm going to ask Leo to just speak for 3 or 4 minutes to try to give a couple of resources and highlight some resources that we have available to help you if you're comfortable reaching out to your communities and serving as ambassadors. But we'll do that really quickly, and we'll be sure to share the slides as well so that everybody can see it. And so if we can wrap that up in the next 3 or 4 minutes, and it'll leave us about 5 minutes for questions.
Okay. Let me.
Oh, and I apologize. So Leo is currently our Director of Public Health Planning and Operations at GHC3. He's directed and managed international and domestic health programs for over 20 years, and most recently served as a Senior Advisor for Strategic Management and Operations at the Africa CDC. He has over 27 years of experience at the U.S. Center for Disease Control as well. So we welcome Leo to give a few comments, and then we'll go to questions. Thank you.
Okay. Hi, everybody. Can you see my screen and hear me? Okay. Okay. So what I'm going to do is just very quickly just make you aware of what's available on the slide set, since we don't have a lot of time, so you know that you can have some resources to look at. First off is what we are learning in this COVID project, and not only in what the research that we're doing, but also in the greater vaccine acceptance and confidence space. There are some takeaways here. Thinking about the focus of you getting involved in being a vaccine ambassador. Here's some good words from James Baldwin that can help you define and look deep into your heart to figure out what you should do and how you should do it. And what I have put together for you is just a few slides and a few resources and ideas of what you can do, okay? Such as plug into existing COVID outreach programs, plug into existing national organizations, volunteer with an organization fighting COVID misinformation, organize yourself and fill gaps. And here's some information about other things that you can do that you wouldn't actually think there was a need, such as, walking up and down your street and knowing, are there elderly, infirm, and disabled folks who don't have access to transportation or anyone to take them to get their immunization? So just simple things like that. And also, for those of you who are may be interested in doing this, there are social media apps. There are ways that you may want to, work with existing community groups to, let's say you want to do something on your own. You're gonna need some help in navigating the community and groups and get an entree into the area where you want to be working, okay? And most importantly, look to see what's going on in your community and leverage existing resources that are there. Don't do anything from scratch, because there's a lot of resources out there. The challenge is just plugging into them, finding them and plugging into them, okay? And then there's a whole list of resources that we've made available, and they're on this slide deck, and we will make some more. As well as, I believe, Stephanie, we can also collate and answer questions that weren't addressed in this chat and send them out to folks. Okay.
Absolutely. Thank you.
Thank you.
And I know Dr. Womack is thinking, oh, sorry, there's a question from Asia Newsom. Okay, maybe her hand's raised on accident. Oh, sorry, yes.
Okay, thank you guys for coming on and sharing all this insightful information. But I do have a question, because I know throughout our talk, we spoke a lot about vaccines, and immunity. Like, what does that look like, since everyone is so different? And a lot of times when we go to doctors, we all know one thing does not work for everybody. So can you please touch base on what does immunity look like when we're all so different? We all have different weak areas of the body. We all have we're just different. So what does that immunity look like?
happy to take that question. And I see a lot of questions also about why are we not promoting natural immunity? So what we know about immunity, and this is the great thing about having clinical trials where you have healthy adults with different underlying medical conditions where these vaccines are given and you are able to understand said immunity. So what we know is if you are younger and healthier, you are likely to have a more robust immune response. What we also know is if you are immunocompromised and older, your immune response will not last, as long, which is why they're eligible to receive boosters right now. So I'm glad people asked a question about why let's just kind of rely on natural immunity. If we relied on natural immunity, right now we have 700,000 human beings who have died in the United States. We would be at millions at this point. So, and with COVID is deadly. And really deadly for certain populations. So like, with something like a virus, like a cold virus, we don't have vaccines against the vast majority of those because, you don't have horrible outcomes. With the flu vaccine, we ask for people to get the flu vaccine because we know that there can be severe outcomes. With COVID, it's a virus that has horrible outcomes and a tremendously increased likelihood of death, even compared to flu vaccine. Also, you don't want to rely on natural immunity, rely completely on natural immunity, because you don't know if you're going to be that person who contracts COVID, gets sick, gets hospitalized, and dies. I have young people, a 30-year-old Black man with absolutely no medical problems at all, who went to work every day. He was not even eligible to get the COVID vaccine at the time that he died. He came in and was dead within 6 hours. So, I understand, berries and nuts and healthy eating. I promote all of that as well. And I believe in my own natural immunity, but taking that chance to die or taking the chance to contract COVID and spread it to someone who has a suppressed immune system, it's not what I can do. And if we all relied on natural immunity, we're going to be in the midst of this pandemic for years to come with devastating outcomes.
And along those lines, there's a couple of questions about 5 to 11-year-olds and school mandates. Pfizer just submitted all the paperwork to get the vaccine approved for 5 to 11-year-olds, and that should be coming, I think, the first week in November. School mandates are something that could be coming as well, and that's something that each school district will decide for themselves in terms of whether to mandate the vaccines. But so far, and Dr. Wiley or others, it looks like the vaccine is safe for 5 to 11-year-olds based on Pfizer's initial data, and the FDA is undergoing its very rigorous review process right now.
Absolutely. And kind of speaking of immunity, if you want to see some people with phenomenal immune responses, it's these little kids, like those in these trials between 5 and 11, after that second dose, they're 98, 99, 100% vaccine effective. So this is a wonderful way to protect our children.
And one last point, there was one comment about if you're vaccinated, does this increase the likelihood of others contracting COVID, and just this idea of some part of the virus circulating in your body. That's not true, but I'll let you elaborate.
Yeah, so that's a great question as well. So if you are vaccinated, number one, the likelihood of you contracting and becoming severely ill is really low. Can you transmit virus? I'm vaccinated, but if I contracted COVID, could I transmit to someone else? Yes. Is there a dramatically decreased likelihood of that happening? Yes. So this is why it's really important. Even though you're vaccinated, when I leave my house and go to the store, I put my mask on. If I'm around a bunch of people, especially inside, I put my mask on. I still wash my hands like crazy. So yes, but I have a sense of kind of peace, knowing that if I contract COVID, the likelihood of me becoming severely ill or dying is really low.
Okay, one last question and then we'll end. So Moderna is not fully approved by the FDA yet. They're in the process of submitting all their paperwork and getting that full approval. So Pfizer is fully approved. Moderna and Johnson & Johnson are still under that emergency use or authorization. But again, these processes are very robust to protect all of us. And so we're respecting the time that it takes for that review to happen. But again, these vaccines have been in hundreds of millions of people to date, and the safety is pretty apparent from that. So we just want to close by thanking our speakers, thanking everyone from attending. There's been a lot of comments in the chat on recircling and doing this again and having open discussions. We're huge advocates of that. As Dr. Womack shared, having community discussions, there really, quite frankly, hasn't been enough in this country. We're doing some through COVID, but allowing open forums of discussion and chat we think is really critical for clearing up misconceptions, allowing people an open forum to discuss and to share ideas and to really feel comfortable in your own decision, as well as hopefully promoting others to do so as well. So we really appreciate the opportunity, and we look forward to maybe seeing you again. So thank you very much.
Yep, and before you guys end out, I just want to make sure I share with you guys, just to say thank you, first of all, to the speakers and the presenters. Thank you to GHC3 for the content they shared, and want to reassure you guys that we have a number of sessions coming out throughout the month. Again, these guys have been great. We now also realize that 1 hour is not enough time. We're going to basically work on building up the amount of time so we get more than an hour, but we're going to ask you to make that time available. In the next session that we'll probably have in about in 2 weeks, it'll be Dr. Jane Morgan, who will be coming in to talk about vaccinations and keeping it 100. We'll probably spend a lot of time answering a lot of those questions that you guys are having. So we're looking forward to that. So make sure you're ready for those. We're going to also try to answer some of the questions that you had in this conversation. And then by the end of the month, we'll also have Dr. Rue, who will be joining us to continue talking about the health and equity in Microsoft in action. So super excited to have you guys here today, GHC3. Thank you to this team that's been put this together. Thank you, Dr. Womack, Dr. Zanti. Thank you so much, you guys. Enjoy the rest of the day, and thank you again.
Thanks, everyone.
All right, thanks, everyone.
Thank you.
Bye-bye.